Good afternoon. Thank you for joining us today. We wanted to share with you the impact and change in the situation in San Diego as it relates to the state's announcement on the regional stay-at-home orders today. I'll briefly walk you through what it means for San Diego County. Supervisor Vargas will share some information, and then our public health doctors are here to answer any questions that you all may have. As you're most likely aware, the regional stay-at-home order has been lifted. This California Department of Public Health and Governor made that announcement today. The state's projected ICU capacity over the coming weeks shows Southern California to be below, or to be greater, than 15% threshold that triggered the regional stay-at-home orders. The practical impact of what that means is in San Diego County, we will return to the purple tier. That is the entity that we were in prior to the regional stay-at-home order being put in place. And I will walk you through what this means, but the most common ones is outdoor dining can resume. Personal care type services, your hair salons, barbershops, nail, tattoo, and massage can also resume, again, consistent with their safe reopening plans, along with some changes in youth sports in terms of practice and those that can begin operating, and I'll walk you through that here in just a minute. I think as in San Diego, look, we've seen positive developments in terms of our case counts beginning to come down. We've seen some modest reductions in our hospitalization, some lowering in our percentage of positives, and I think as San Diegans, we can take a measure of pride in knowing that we did beat back the most severe aspects of the recent surge that we've seen, and that has put us in a position, again, to come out of the regional stay-at-home order for all of Southern California and put San Diego in a position to begin to reopen some of the lower risk type settings. But we want to be mindful that today's announcement is not a moment where we need to abandon our vigilance or lose our focus. Although there are new things that are opening up, and that is encouraging, particularly for those entities that have been so impacted by COVID, it's an opportunity for each and every one of us to recommit and refocus on what we're doing. We are administering vaccines daily, and that is certainly going to help, but we need to stay safe in order to stay open. And we want to continue moving through the tier system in the coming months while we simultaneously administer vaccines and get out of this. And so we still have to wear our mask and wash our hands, physically distance from non-household members, and avoid high-risk settings in order to keep the trajectory and forward momentum that we've gained over the course of the last week or so. We want to continue to have that moving. We should also aspire as a goal that we want to get to the next tier down, the red tier, and we have a considerable ways to go in terms of our case counts. This does provide some measure of certainty. I think we're familiar with the tiered system in terms of what it measures. It measures, obviously, case counts and adjusted and unadjusted, and we know where we have to be in order to move down. And again, we have a long way to go before the red tier, but opening the purple tier will hopefully provide some relief again to those businesses, particularly our restaurants and our personal care services that have been most heavily impacted. All of our efforts around vaccine continue, and we'll give a full report and update at our Wednesday briefing. We have brought on 2 additional pods. We have more super stations in the work, and are going to continue to press forward to get as many vaccines as we can administered as possible. So let me walk you through a couple charts on what we are looking at as it relates to purple tier operations. You'll see here at the top, restaurants outdoors only. The time limitations, which we have had since May, I believe, remain in place for San Diego County. Again, this is for restaurant operations, outdoor dining only, 5 a.m. to 10 p.m. Folks can order by 10 p.m. They need to complete their outdoor dining by 11 p.m. Takeout and delivery are good 24 hours a day. One addition that's different than last time we were in the purple tier is the state has authorized live entertainment is allowable and authorized in those outdoor settings only. Wineries, again, can operate outdoors also with live entertainment, consistent with restaurants. Bars, breweries, and distilleries that serve food operate exactly as restaurants. Hair salons, barbershops, nail salons, tattoo parlors, massage, other personal services can operate indoors. They have to follow the safe reopening plans, the same ones that they had developed when we were in the purple tier. Post that information outside that safe reopening plan and can all start operating. Grocery stores go to 50% capacity, retail at 25%. Hotels are open, professional sports continue, but without live audience. Offices remain remote. K through 12 schools are still distance learning, if not already open for in-person instruction. There's an application process for K through 6, and that will be shared with schools, and amusement parks remained closed. The next tier here, these are outdoor operations only. Places of worship, outdoor, gyms outdoors, family entertainment centers, again, these are all things that are outdoor. Youth and recreational adult sports, all entities are allowed to practice at this point, provided that there's no contact between participants and they maintain their 6-foot physical distancing. Intra-team operations are allowable for those entities in the purple tier. And so on the county website and on the state website as well, you'll see a list of what those entities are in the purple tier. Things like track and field, swimming. There's a few other ones that are allowed to resume their normal operations in the purple tier. And then you can see there as we go through the tiers, additional youth and recreational adult sports that are added in. But right now, intra-team play is limited to those in the purple tier, but other sports can practice provided that there's no contact between participants and they can maintain physical distancing. Movie theaters, zoos, and aquariums and outdoor recreations, including camping, again, are allowable for outdoor type settings. And then the final slide here is the purple tier gatherings. This guidance was put in place before we went in the regional stay-at-home order, and these are gatherings of up to 3 households are allowed to gather together, provided they're outdoors, stay 6 feet apart, and utilize their face coverings. As we head into this phase, I think, again, there is some reason for us to know that we are advancing in a positive direction. We've seen some positive impact on our cases, very modest declines beginning in our hospitalizations. Our percentage of positive is improving. Because of the lag effect behind things, we're going to monitor closely the local situation here as it relates to hospitalizations. And then, unfortunately, we're likely to see increased numbers of loss of life, again, because of the lag between all of these things. So today's announcement will come as a relief for a lot of folks who were impacted by the regional stay-at-home orders, but we really have to be mindful as a county and as a people that we don't want to change the trajectory we're on. We have to avoid those high-risk settings. We all have to continue to take action. We want to see these case numbers continue to descend. We want to be encouraged by the vaccines, but knowing that we still face limited supply. Hopefully that opens up soon. But let's not lose our vigilance. Let's not lose our focus. And let's continue to do the things that we've done that have helped improve our situation. With that, I'd like to introduce Supervisor Nora Vargas to give an update, and then we'll get right to your questions.
With today's announcement of regional state orders being lifted, and thank you, Chair, by the state of California, I just want to remind everybody, encourage everyone to continue doing their part, wearing your face mask, physical distancing, and making sure that we're outdoors if we're doing any gathering between 3 families or more. While we continue our vaccine rollout, we're still not out of the woods, and we're asking everyone to follow precautions for your own health and safety and that of your families and your neighbors. To our businesses, we're asking that you reopen safely, that you continue to be mindful of your employees and your patrons, and ensure measures are implemented for everyone's safety. The COVID numbers in the communities of concern are still heartbreaking. Like many San Diegans, I would like to see us go back to our daily routines pre-COVID, but we first must ensure that it's safe to do so. Just know that we are committed to increasing access to testing, tracing, and continue to make sure that we're getting everyone vaccinated. It's important to note that we want to acknowledge that we are hearing from residents, especially those that are 75 and older, that they are experiencing trouble making the appointments. If you're 75 or older and do not have access to a computer or someone to assist you, please continue to call 211 so that we can help you connect you to a healthcare provider or someone who can make a vaccination appointment for you at the County of San Diego site. So we're going to continue to do this work. We're trying to make this easy for folks as we're opening up the pods. Ahora, en español. Como mencionó el Chair Fletcher, con el anuncio de hoy que el Estado de California levanta las órdenes regionales de quedarse en casa, le pedimos por favor a todas las personas que sigan usando sus cubrebocas, que practiquen con la distancia física y eviten cualquier tipo de reunión que no sean con las familias que sean parte de su comunidad. A medida que seguimos con la distribución de vacunas, aún no estamos fuera de peligro. Les pedimos que continúen tomando las precauciones necesarias por su propia salud y su seguridad y la de sus familias y vecinos. A nuestros negocios pequeños Les pedimos que a medida que reabran los lugares, restaurantes, lo hagan de forma segura, siendo conscientes de sus empleados y clientes e implementando medidas para la seguridad de todos. Las cifras de COVID en las comunidades de interés son muy preocupantes todavía. Con muchos habitantes de San Diego, a mí también me gustaría que volviéramos a nuestras vidas rutinarias antes de COVID. Pero primero debemos asegurarnos de que sea seguro hacerlo. Estoy comprometida, como estamos todos aquí en el condado, para seguir aumentando la oportunidad para pruebas y para que las personas se vacunen. También quiero informarles que nos han buscado mucho e informado que estamos escuchando de los residentes, especialmente a los mayores de 75 años de edad, que están experimentando problemas al programar sus citas para vacunas. Quiero que quede claro que estamos buscando otras maneras de poder ayudarlos, inclusive buscar transporte, pero de cualquier manera, si tienen 75 años o más y no tienen acceso a una computadora o alguien que lo ayude, puede llamar al 211 para que le ayuden a comunicarse con su proveedor de atención médica o hacer una cita de vacunación en un sitio del condado de San Diego. Muchas gracias.
Thank you, Supervisor Vargas. We'll now go to your questions, our call-in questions first.
Ashley Jacobs, Fox 5.
Hi, I actually do not have a question anymore. Everything I needed was answered. Thank you very much.
Wonderful. Thank you, Ashley. Next question.
Artie Ojeda, NBC 7.
Good afternoon, everybody. A couple of questions. Number one, since case rates are the key to moving, or one of the keys to moving to the less restrictive red tier, can you give us an update on case rates, current case rates in the county? And secondly, and more important, as you know, the fact is many businesses, in particular restaurants, have simply ignored recent health orders with little or no resistance from local jurisdictions. So based on current case rates, it would seem we are a long ways from moving out of the purple tier. What are your expectations of people actually following purple tier restrictions, or will this brazen violation of existing health orders just continue to go on unchecked?
Yeah, thank you, Artie. So presently, our unadjusted case rate is 67.7. Our adjusted case rate, and you'll remember we've always gotten an adjustment factor because we're doing considerably more testing than most counties. Our adjusted case rate was 49.6. And if you remember, we have to get to 7.0 or below to send into that next red tier. And so we have a considerable ways to go. We have, if you look back, it wasn't that long ago. We were having cases consistently in the 4,000 plus range. Obviously, that has come down. We're going to need to see that trajectory continue and continue for a fair bit before we're anywhere near the range of going to a lower tier. And so we hope that the actions and activities that people have been taking to bend this curve and begin to turn the corner on this and get it down will continue. And we're obviously hopeful that not having a major holiday like Thanksgiving, Christmas holiday, or New Year can help us do that. But the message today to the public is not, hey, everything's great. We have bent a curve. We have begun to move in a positive direction. But we have a ways to go. And the entities that are open no doubt want to stay open. The open-close type situation is probably most devastating for businesses. And the way that we control that and that we move forward is that every San Diegan continues to take individual responsibility to do everything within their power to do it. And then we will continue as a county, Artie, as best we can with the enforcement authority we have to now enforce what is allowable and what is acceptable within the purple tier. And so all of the enforcement actions will continue. They'll just be focused on what is allowable in the purple tier. And we hope that the current trends continue and even accelerate. And then the last thing is, as we move deeper into vaccines, we hope that also provides some help and assistance to the situation we're facing. Next question.
Matt Hoffman, KPBS.
Hi, I was just wondering if Dr. Wooten or Dr. McDonald or Dr. Nick, if he's there, could just comment on this new move from the governor. I know he talked about in his news conference today that there was some concern from public health directors regarding some cases maybe from the MLK holiday. And he also talked about how you guys are seeing the same data that the state's seeing. So just curious if you guys think this is the right move, if you think we should have waited, we should have done it sooner.
Yeah, we'll have Dr. Wooten address that.
Thank you for that question. You know, the MLK was one day. We have President's Day coming up and then Cesar Chavez coming up in March. I think the one day, I think it is time for businesses to be able to start having some hope, and I think the move made today was a reasonable one, but we cannot rest on our laurels and not continue to do the preventive strategies that are necessary to continue to stave off our increased number of cases. While we have come down from the 4,000 and 3,000 daily number of cases, we are still in the thousands, and that's, you know, we really don't want to see that. We want to see our numbers go back down to 200 or less. And actually, as we have more vaccinations in place, we hope to see those numbers even become less. But there are other things looming on the horizon, and that are the new strain, B117, and there are others out there, but that's the one that has been detected here in San Diego. So there are a lot of factors in play. Everyone should continue to do what we have asked you to do over the past year. So adhere to those preventive strategies, and we just continue to monitor things, and we see where we end up. Thank you.
Thank you. And then just to follow up to a question about youth sports, I know the governor said that could happen. You guys talked about some low-risk applications. Can you clarify sort of what that means? I mean, does that mean like high schools can restart playing soccer but not football, or how's that kind of spelled out?
Yeah, if you go, it's on both the state website and the county website links to it. Essentially, each of the colored tiers has a listing of what sports can resume play between teams or competitions. And so in the purple tier, it's just outdoor, low-contact sports. There's a whole bunch of them listed, but the ones that are probably most relevant for youth is cross-country, golf, running, swimming and diving, tennis, and track and field. Those are entities that are allowed to kind of resume intra-team competition between individuals. As we move into the next tier, then you'll see an additional listing of sports that could resume, and then it goes so forth throughout all the colored tiers. Again, sports teams can presently practice. They can practice provided they don't have contact between two individuals and they can maintain their physical distancing. But the competitive nature of intra-team, two teams playing or two individuals playing against each other, again, is based on the tier system. And so the full listing, again, is posted. And as we descend into tiers, then more sports will open up for teams to compete with one another.
Thank you.
Thank you. Next question.
Brandon Lewis, CBS 8.
Thank you. I have a question about vaccination. The state today is saying it's going to move to an age-based vaccination distribution, except for some categories. Part of that based on feedback from the public health officers about how an industry-based approach would work. I'm wondering if San Diego County had similar concerns, and what input did San Diego County provide during the calls with public health officers from across the state when this was being considered?
Yes, I'll let Dr. Wooten comment on what they provided, but just to catch everyone up, basically the state announced today that what we are presently doing is healthcare workers and 65 plus. After we complete that, then we'll move into the priority essential workers, education, childcare, food and agriculture, and first responders. Once that segment is completed, then the new state guidance is then you would do everyone else based on age. So you would essentially pick up at, say, you know, between 55 and, you know, under 65, under 55, under 45. And just to put it in context, we're a ways away from that happening. We're still doing healthcare workers now. We're still working our way through 65 and older. There's still a considerable number of those. Then we have to do that first grouping of essential workers. Again, a pretty large, considerable number of those folks. And then we will see how the transition to an age-based system beyond that goes. This just came out today. But I know Dr. Wooten's been involved in a lot of conversations with the state, and I'll let her fill you in on her thoughts on that.
Thank you for the opportunity to speak more about the prioritizations. In the calls we've had with the state, we have made it clear that we will continue with the phases and the tiers that have been identified. Switching only to an age-based prioritization will be confusing for our general public because there are also essential workers that need to be vaccinated. And the three primary groups would be childcare and education, then emergency services, followed by food and agriculture. And we want to get those groups vaccinated as well. But it all is contingent on the availability of a vaccine. So we will stay the course with where we are currently going. We have now opened up to 65 years of age and older. So we will continue that, and as we get more vaccine, we will then focus on those three essential workers and then see what happens after that. Thank you.
I'm sorry, Dr. Wooten, so just to clarify, are you saying that there's a possibility that instead of the age base that came out today, we could continue going with the tiers that are already out there because it's confusing?
Well, the tiers already includes age-based guidance. So right now, we're in 65 and above. In the next tier, it is 50 to 64, and then 16 to 49 years of age for individuals that are at high risk. And we will follow that process. So we are not abandoning the age prioritization. We are continuing to do that, but we will also make sure that key essential workers that need to be vaccinated will also be included.
Okay, thank you, Dr. Wooten.
Yeah, so we're going to continue. Again, we're doing healthcare in 65 and older. Next, we will go to those essential workers, healthcare. I'm sorry, and next, when we finish that, then we will go to childcare and education, first responders, food and agriculture, and then when that's completed, we will let you know what the current guidance is, because it may change again between now and then. But we have plenty ahead of us. We got to get through in the interim. Next question.
Miriam Rafferty, East County Magazine.
I have a couple of questions. The first one is a follow-up on the enforcement question. It isn't just restaurants and bars that are, the problem with violating the rules. I've had a lot of readers email me who are really angry over seeing the mayor of El Cajon out speaking at a religious gathering, an outdoor worship service in downtown El Cajon, but we had a photographer there. There were probably 700 or 800 people there. Almost none of them were wearing masks. They were very close together. Can the county or will the county do anything to enforce the rules? I mean, to prevent more super spreader events out there? A lot of people are very worried about that.
Well, we're going to continue, again, to enforce the public health orders. We have a system in place. People make complaints. We go out. We educate. We investigate. We issue cease and desist letters or public health closure notices when appropriate. And then law enforcement obviously has the follow-up if folks don't modify or change their activities beyond that. And so we're going to continue to do that and do the best we can. Obviously, there is a lot of folks, and there has been from the very early days of COVID that are going to continue to make choices to not do that, and we will do the best we can to enforce, the limited authority we have as a public health agency, and then working with our law enforcement partners in jurisdictions that choose to work with us. So we're going to continue to do the best we can to get through this, understanding that there are a lot of folks out there, including some elected officials, who are going to continue to advocate open defiance. And all we can do is share with people what's happening, the impact. There's a unfortunate irony that unsafe events and things of that nature only serve to increase the case count, which only serve to punish our small businesses, our healthcare workers, and those individuals who lose loved ones. So we're hoping in a new year we could have a new sense of the way we slow the case count, and the way we open businesses is do the exact same thing and follow the health measures, but we're going to continue to work through it.
Yeah, thank you. I'm one of those that just lost a family member, so it's,
I'm very sorry.
Take it personally.
Of course.
Thank you. My second question is, journalists we were on the initial list of essential businesses because we can't do all of our work by Zoom if we need to go out and cover a wildfire or a protest or a riot, all of which my reporters have, risked their safety to do. That's considered essential, and yet we're not on the list for getting the vaccine anytime soon unless you happen to be in the, above 65, and none of mine are. Is there anything that the county can do to put a bug in the ear of the folks up there at the state that they ought to add journalists, at least those that, maybe have press passes and are allowed to be out and about during this so that we can get out doing our jobs.
Yeah, no, I understand. And I think right now, obviously, we're doing 65 and older and healthcare workers. Next, again, we'll go to education, childcare, first responders, and food and agriculture. And then after that, the original plan was to work through another tier of essential workers, people who have to go to work. The state guidance out today suggests that instead of going to those other essential workers, you would just go to a straight age-based system. But we're a little bit of ways away from there. We're still doing 65 and older and healthcare workers. We got to get through that. Then we've got to get through a very large number of essential workers that are in the 4 tiers I outlined, 4 categories I outlined.
Yeah.
And then I think once we do that, then we'll have greater clarity on where we go after that.
Yeah, that would be good. I've also had people who work for the court system, like public defenders who meet with people coming out of the jails, where obviously they're at risk of this, and they don't seem to be on that list anywhere. And a lot of them are younger, but they're at risk. They can carry it home to their families. So
yeah. So the new state the new state guidance just came out today. So we'll continue to work through that. And again, we're a considerable ways away from confronting that situation. So I think there's some time to get greater clarity on how that will work. Next question.
Lori Weisberg, San Diego Union Tribune.
Hi. Not to belabor the enforcement question, I guess I will. One thing I wanted to follow up, there were a number of cease and desist orders distributed or sent to businesses or restaurants that were staying open for outdoor dining. Do those cease and desist orders and whatever citations associated with them, does those become moot because now they can reopen, or will they still be punished for being open for outdoor dining when it wasn't allowed? I just didn't know how you're focusing your resources there. Do you give up on that now because they're back open for outdoor dining?
So the cease and desist letters include language in there that you need to cease and desist operations until you're in compliance with the public health measures. And so if the cease and desist letter surrounded an outdoor dining situation, then they would now be in compliance by doing outdoor dining. And so the letter would essentially validate what they are doing now, and there would be no action. Any citations that were written, again, would be at the discretion of the district attorney or city attorney. And we'd have to refer you to them, although I don't know of a significant number of citations that have been issued. But again, the cease and desist letters can include language about cease and desist until you're in compliance. And so if they were sent the letter because of outdoor dining, then it would no longer apply.
Okay, thank you.
Thank you. Next question.
Jacob Ayer, KPBS.
Hi there. Thank you for taking my question. Mine is regarding the Petco Park Superstation today. They had to postpone all vaccinations due to the bad weather. Does this weather system that's currently happening make the county rethink the plan on how to effectively administer vaccines at the Petco Park Superstation, considering winter weather will likely be here for at least another month? Then I have a second part to that question afterward about what's going to happen Thursday.
Yeah, the weather today was not normal even for winter conditions, particularly the wind in particular, which caused some damage to some of the structures that were there. We do think we have a mix of walk-in locations and some that are drive-up. The drive-up locations have been very convenient for San Diegans. They're very safe in terms of people not having to leave their car, and so we do think it's appropriate to have a mix of both. And so we will work to kind of fortify those drive-through locations. Again, it was excessively high winds. We think that we can make the appropriate adjustments and resume operations very quickly. We also think we'll be able to catch up any missed appointments from today or perhaps part of tomorrow at that one location in the coming days by just expanding our hours of operations. Individuals who had an appointment that was canceled are being contacted and they're being prioritized for rescheduling this week so that they can still get in. So we don't control the weather, but obviously we think a mix of both type of settings is helpful and convenience for San Diegans, and we're going to work to, again, fortify our locations. And we can operate these with rain, and we can operate these with normal winds. Just today had some excessively high gusts of wind that caused some damage to that one site. But we look forward to getting it back up and running, catching up our appointments in the coming days and continuing. None of our other vaccination sites were interrupted today. It was just that one.
And then the follow-up to that would be, the people who did get their appointments postponed, a lot of them got messages rescheduling for Thursday. Is the plan to double down and vaccinate more than the standard 5,000 people and do like 10,000 people that day? And would that be by expanding hours or increasing the workforce there to help?
I don't know that we could necessarily double the number we do in a day, but the goal is to increase the throughput and look at increasing the hours to try and catch those up as best we can. And we think by the end of the week we hopefully can be caught up and not miss any of them, get back made whole.
Okay, so by changing the hours of the site or by bringing in more staff?
Both.
Okay, thank you.
Next question.
Our final caller is Paul Sisson with the San Diego Union Tribune.
Thank you for taking my call. First, I wonder if we could clarify the new sports guidance that has come out from the state today. I don't recall them ever listing specific sports that could resume team-on-team competition. Can you verify that my memory is correct there in terms of this is the first time that we've actually had state say you can resume playing games of these types of sports?
Yeah, your memory is correct. That guidance just came out. So it is new guidance.
And then thank you. And then secondly, I think I and a lot of folks in the media have been getting a lot of tips and complaints over the last few weeks that certain organizations that have gotten early supplies of vaccines, especially healthcare organizations, have been vaccinating non-clinical workers who don't really have a lot of patient. I know that the county runs the vaccine registry, electronic registry that all of these doses are put into when they're administered. Has the county taken any steps to audit the vaccines that are being provided to make sure that they're being given to the appropriate people?
I'll have Dr. Wooten address your question, Paul.
Thank you for that question, Paul. While our San Diego Immunization Registry is a great tool, we do not have the capacity, by and large, to look at individuals by their classifications, by what classifications they're in. So that's a difficult strategy. But when it comes to healthcare workers, it is a very broad definition for healthcare personnel. It includes volunteers, any vendors or contractors that might have been associated with an acute care hospital. So it's not all clinical people. It's the environmentalists, the individuals that are in meal services. So it is very broad, healthcare personnel. So it's basically anyone that is in the hospital because of the increased risk of exposure to the SARS COVID-19 virus.
Okay, thank you, Doctor.
Sure.
We'll now go to our text questions.
This question is from Mike McKinnon with KUSI. Will San Diego County be following the state of California governor's lead and lifting the 10 p.m. curfew on restaurants? If it is not being lifted, then what is the science and data that supports that decision?
Thank you. Dr. Wooten will address that.
Thank you for that question. If everyone remembers, we actually had that particular order in place before the state. And the rationale, so businesses can serve their last customer at 10 o'clock and then be closed by 11. And the rationale for that is that we were seeing particularly bars open and people gathering and not adhering to the health officers' order. So we will continue that particular order, and that the rationale for doing that is as I've just stated.
Thank you. We'll go to our next text question.
This one is from Kelly Beal with Fox 5. She asks, can you elaborate more on the live entertainment at restaurants? What is the capacity limit and only outdoors? And also, can you please tell us the reason behind this move?
Yeah, thank you, Kelly. There is not a hard number in terms of capacity for outdoor dining. It's based on the layout of the place. They have to maintain 6 feet physical distancing between each of the tables, and provided they have the space to do that, then they can monitor their own capacity based on meeting that threshold. The state did add in live entertainment for outdoor settings. I think they determined it to be a relatively low risk to have someone perform music or whatever it may be. And I know that's been a top request of a number of folks who are there. And so I think as we move back into the purple tier, it is not considerably different from where we were when we were in the purple tier before, with the only addition of the ability to have live entertainment in an outdoor setting, again, provided that people maintain that physical distancing between parties and adhere to all of the other safety protocols. Next question.
This question is from Claudia Buccio. She asks, I'd like to get this response in Spanish. First question is, will the county open up the 211 vaccine appointment system based option to people over 65 as well, since many aren't tech savvy? And then she has a question for Dr. Wooten, so.
Sí, la pregunta es, la pregunta es específicamente para las personas aquellas que tienen 65 años o más, que si pueden hacer sus citas que necesitan para la vacunación. La respuesta es que por el momento solamente las personas que tienen 75 años o más, los invitamos a que hablen al 211 para que les puedan hacer una cita, ayudar a hacer una cita, porque es importante que tengan cita antes de ir por su vacuna. Ahorita lo que está haciendo el condado es que estamos trabajando con las organizaciones de las comunidades y el condado directamente para ver si podemos expanderlo a los 65 o más, pero por el momento es solamente las personas de 75 en adelante. Gracias.
Okay, this next question is for Dr. Wooten, and she's asking, she says, there have been record deaths in our region just last week, and many still hospitalized. What does this say about our local situation? Are we flattening the curve?
Thank you again for that question. When we talk about deaths, deaths are very delayed. They're down there with outbreaks. So the more practical metric that we want to look at is the number of cases. And as you've heard, the state uses case rates and testing positivity. So we have been as high as in the mid 4,000s. Luckily, in the past week or so, we have been definitely maybe 1 or 2 days in the 2,000, but most days in the 1,000. So overall, those cases are going down, and that's what we want to see, the trending down of daily case reports as well as the trending down of hospitalizations. And even though hospitalizations are also delayed, but it really is the cases that we want to see trending down, and we have been seeing that. As stated on last week, we are cautiously optimistic and we are going in the right direction, but we really want to see those daily cases even be lower than, say, 1,400.
One quick clarification for Kelly from Fox 5. I answered your question about occupancy of patrons in outdoor dining, but I think upon reflection, your question might have been about occupancy of live performers. So the guidance is there needs to be 12 feet separation between a live performer and the patron. So someone sitting at a table in an outdoor dining environment needs to be 12 feet away from someone, say, performing music. If there is more than one performer, they need to be 12 feet apart from each other. So again, 12 feet is the guidance between patrons and performers and between one performer and a second performer. And so that is the guidance around the occupancy surrounding that aspect. Next text question.
Okay, Taryn Mento with KPBS has a question about the My Turn platform. The governor said it is being piloted in LA and San Diego. How is that platform working so far, and what are you examining during this pilot phase before the state expands it?
Yeah, we are using it. Our team here has spent considerable time with the state. There's so many different aspects of the portal that needs to work properly, from the user interface of a San Diegan trying to get an appointment to all of the back-end systems of connecting all of the appointments with various locations and the updating of data. Right now, we are utilizing it on our website for our community pods. So you can go to, if you go to the vaccinationssuperstationsd.com, for several of our sites, our superstations, you still book an appointment direct through those. But for our community pods, those have all been consolidated into MyTurn. We are working rapidly to incorporate the superstations into that. And the goal of where we hope to be very soon is for the superstations and the pods, county-administered pods that we're running, that people can go to one place again and assess all of those. So we continue to work through that. I think in the first day or two there were a few kinks, and so we're continuing to try and refine that. We had a county portal we were about to launch, but the state said this was coming, and so we didn't want to switch people between one system and another. And so, we think that there are some benefits that are coming from it, and we will continue to provide feedback, but it is being utilized in some capacity now. And I think one feature that is most promising is anyone can sign up for information and alerts for when it is their turn. And that feature is presently up and running. So we'll continue to work to refine it, continue to incorporate more aspects of what we're doing as we move forward. All right, that concludes our questions for today. We appreciate everyone's tuning in. Again, we are as a county moving back in the purple tier. That is encouraging, but we also want to keep our downward trajectory to get to lower tiers, so we continue to encourage everyone to stay safe. Let's stay open. We are moving in the right direction. Let's try and stay on that direction and trajectory this time. And again, thank you all for your time. We'll be back with you Wednesday afternoon for our normal COVID updates.